Good evening, families. Welcome to our Innovation in Healthcare session with Americans for Prosperity Foundation. We are excited about tonight's session. We're glad that you were able to join us. I believe you'll be pleased with the information that you'll receive tonight. Again, if you can turn your cameras on so that we can see your lovely faces, that would be awesome. We understand some of you might not be able to do that, but for those of you who can, please do that so the facilitators can talk to you and not talk to your name on the screen. So, welcome. This is our 24th session this year, and we have a couple more to go in April. We will be sending out registration for this upcoming 2021-22 school year on April 1st. So please read all the information that we send you, and then registrations will be due to us by the end of April. So we're excited about the upcoming school year. Not sure what that's going to look like across the board, but we are moving forward with what we know at this point in time, and we'll be looking to develop all of our parent empowerment sessions as well. We will be sending out the final student parent-student journal after our probably after our last session. So the third week of April, we'll be sending that out. And so that information along with report cards will be due. So more information will be sent to you, but please make sure that we're not in your spam so that you get all of our emails. And then any questions that you might have, please follow up with those. So again, we're excited to be here tonight. Josh from AFP is going to do the intro for our session tonight, and then our facilitator will take it from there.
Awesome. Thanks, Deborah. It's good to be back with all of you guys. Good evening. For those of you that don't know me, my name is Josh Shee. I'm a Community Engagement Director with Americans for Prosperity Foundation here in El Paso County in Colorado Springs. For those of you that don't know about Americans for Prosperity Foundation, basically what we've been doing for over 20 years have been educating, training citizens to advocate for freedom, to create real change at their local level, state level, and federal levels. And so, I mean, we wanted to come today and talk about healthcare innovations, right? Because healthcare is something that's so important. Deborah and I were actually just talking. It's crazy. Last time we did this with you guys last year, I was actually sitting in the ICU with my daughter, and it started a journey over the course of, I mean, this past year of just learning about our healthcare system, the intricacies of it, working through insurance. My daughter has a very rare syndrome called Emmanuel syndrome, and so it's been a really enlightening view of seeing some of the really good things about our healthcare systems, but also there's a lot of places I think for reform, and that's Mike is one of the experts there. And actually, without further ado, I want to introduce him. So Mike is one of our Grassroots Leadership Academy speakers at Americans for Prosperity Foundation. He grew up in Canada, experienced healthcare there, so a completely different system, a system that I feel like oftentimes is put on a pedestal, right? And said, hey, this is where we should aspire to be as Americans. And he wanted to come share his experience about his healthcare system in Canada, but also some of the things that we're working on here in the States to bring innovation to our system. So Mike, without further ado, take it away here. Excited to hear from you.
Thank you, Josh. Thank you, Deborah. Thank you, Catherine. And thank you to all of you for your time and attention on this really important issue of healthcare innovation. And before we get into the meat and potatoes of everything, if at any point in time you have a question or comment that you want to chime in, you're more than welcome to. You can throw it in the chat. If you want to unmute yourself and speak, you're welcome to do so as well. I will also be reserving probably the last 10 to 20 minutes, depending on how many questions or thoughts that you have, for any outstanding things that you want to talk about. So I'm super excited to be here and to talk with you all. And as Josh mentioned, I did grow up in the Greater Toronto area. When I was 14, my mom had a job transfer. We moved out to Iowa, which is where I live now, became a US citizen in 2018. Very proud moment of my life. And one of the fascinating things going from Canada to the United States is some of the attitudes that we see towards Canadian healthcare. As Josh mentioned, a lot of people like to see it as a utopia, as it's just amazing and it's perfect. And that's not to say it doesn't do some things well. But my experience wasn't exactly what other people talk it up to be. I remember growing up, there was an instance where I injured my shoulder and I needed to go see a doctor to get a referral for an MRI. And I remember going to go see that doctor and him saying, well, I can get you the referral, but it's going to take well over a year. And your best bet is to go across the border into Buffalo, New York, because there you could access private clinics so long as you're willing to pay for them. It was a very eye-opening experience for me. And as I've had the opportunity to travel around the United States, I've met other Canadians as well who have moved out of Canada and moved to the United States out of frustration from the Canadian healthcare system. I believe there's a statistic from the Fraser Institute that says that every year over 35,000 Canadians go across the border into the United States for additional healthcare services because they're not available in Canada. And there was one experience that was very eye-opening for me. I was in Davenport, Iowa, and I was talking about my experiences, and someone came up afterward and said, "Excuse me, we have someone from Canada here that wants to talk to you about healthcare." And I thought, oh, okay, well, maybe they're going to lecture me about why I'm wrong or something like that. But the guy came up to me and he said that he used to be a doctor in Canada's healthcare system, and that he actually moved away from Canada to Davenport, Iowa, because of how frustrated he was with the way things were going there. And he told me that there are more MRI machines and CT scans in Davenport, Iowa, a city of 100,000 people, than there is in the entire Greater Toronto area, a place of 3.4 million people. And why is there such a discrepancy? There's a lot of factors at play here. But one of the things that we really want to delve into tonight and talk about is how we can get the best possible healthcare at the lowest possible prices. Because at the end of the day, we just want the best for ourselves, for our families, for our communities, and for the people around us. And one of the bigger issues that a lot of people have noticed within Canada's healthcare system, and to a lesser extent within the United States' healthcare system, is an inertia to innovation. People being afraid of taking risks, of creating new ways to treat people, to serve people, and to make people's lives better. And we've seen that through constant cases. For example, if anyone's been following telemedicine in the developments there's been a ton of inertia from a lot of different healthcare providers to give people the ability to visit and talk to their doctor or some kind of general practitioner or a nurse practitioner from the comfort and confines of their own home. And it's been getting better over time, but finding new ways to treat people and finding new ways to expand care for individuals is the best way to empower one another and create the best possible outcomes for people. Someone who does a really good job of explaining what's at stake here in the healthcare discussion is Dr. Bob Grayboys from the Mercatus Institute. And I want you all to take a listen and see if you agree with his assessment on where the discussion in healthcare is going and where the discussion ought to be going. And if there's any technical difficulties, let me know.
For 70 years, we've languished in a bitter, partisan, unproductive battle over how to fix America's healthcare system. Directly or indirectly, both left and right have steered the conversation toward coverage, the number of people with insurance cards, while mostly ignoring quality of care and how much it actually improves health. To get this debate out of its rut, we need this new goal: to produce better health for more people at lower cost year after year. To start, we have to recognize that the real dispute isn't between left and right. It's between philosophies I call the fortress and the frontier. Let's define them. The fortress has two goals. First is to imagine all the terrible things that might go wrong in healthcare and prevent any of them from happening. Second is to shield those in the medical industry, doctors, hospitals, insurers, drug and device manufacturers, from potential competitors who might threaten their turf. Frontier is different. It understands that big quality improvements and cost reductions don't come without accepting some risk. And it understands that real innovation won't occur unless doctors and hospitals face new competitors like IBM faced Apple and Western Electric faced BlackBerry. While left and right think of themselves as radically different, both are deep in the fortress. To illustrate Fortress and Frontier, let's do a little thought experiment. Get in a time machine, go back to 1989. Tell your family how healthcare has improved in 25 years. Statins, new vaccines, face transplants. They'll appreciate the new technologies, but won't be all that surprised. That's the fortress. Now, and you're still in 1989, tell them what's ahead in IT. Tell them how inexpensive these things are. Now they'll think you're delusional. That's the frontier. Wait, you say, the two things are comparable. Healthcare is life and death, pain and suffering. Computers, they're harmless. They just sit on your desk. Really? On the internet, you'll find financial fraud, identity theft, predators, violations of privacy, cyberbullies. Cell phones have served as tools of crime and terrorism. Does this make you wish the internet and cell phones would go away? I doubt it. For an interconnected world and all of the benefits that come with it, we take risks and accept costs. And we allow upstarts in garages to challenge multinationals in skyscrapers. In 25 years, we've gained near universal access to information technology. That didn't require a long, vicious congressional debate. No cumbersome mandates. No one had to ask innovators to innovate, and innovators didn't have to beg bureaucrats for permission to create. Our challenge now is to move healthcare out of the fortress and onto the frontier, to make healthcare as dynamic as IT has been in our lifetime. That means accepting some risks and allowing genius to arise from unknown people in unexpected places. Make no mistake, enormous changes are coming soon to healthcare. Transplantable organs made of your own cells, drugs tailored to your individual DNA, microscopic robots inside your body repairing the genes that threaten your life. Are we willing to move American healthcare to the frontier so it can lead the way toward these new technologies? Or are we going to remain in the fortress and let other countries seize the high ground? We have time to choose, but not much. We can spend the next 25 years squabbling over insurance cards, but that won't get us to the real goal: better health for more people at lower cost year after year. I'm Bob Grayboys, and all this is in my new study, Fortress and Frontier in American Healthcare. It's at Mercatus.
So hopefully you all were able to absorb some of this and that the sound was working on your end. If you have any thoughts related to the video, feel free to throw them into the chat. You're more than welcome to. Curious to hear what you did think of Dr. Grayboys' thoughts here. If you did miss out because of some technical difficulties, the big thing to remember when it comes to healthcare discussion and when it comes to healthcare innovation is it's important for us to change our mindsets. And instead of focusing in on that fortress, the aspect of trying to protect certain industries from competition, protect certain aspects and certain people from outsiders, it's important for us to develop that frontier type mindset that encourages innovation, encourages new ways to treat people, and tries to expand care as much as possible for individuals who are in need of that care. And there's a lot of great information on this element. And unfortunately, in today's society, too often we see that discussion moving towards that fortress element as opposed to the frontier. And
.org.
One second. And what we really, and one of the examples really to showcase the fortress discussion is the recent proposals of the idea of the public option. And if you know anything about that, or if you don't know the context to it, it's ultimately a discussion upon the issue of insurance cards and how many people have to have insurance cards. And it neglects a lot of the conversation in relation to how we can innovate and provide better care at better prices for individuals. And so it's important for us to look beyond that fortress and think about it from a frontier perspective as to how we can create value for people's lives. And ultimately, everyone should have access to the high quality healthcare that they need when they need it at the price that they can afford it. And a dynamic healthcare system that allows solutions to come from the bottom up, including providers, patients, and entrepreneurs, offers the best way to ensure access. And there's been over the course of the past few years, and even the past few decades, there have been instances of individuals who have created some amazing bottom-up solutions to make healthcare better for everybody. And we're going to be really highlighting some of the advancements that have made and how we can make our healthcare in this country better for everybody involved. But the big thing that we need to do to ensure that we have the best possible healthcare outcomes at the lowest possible prices is to, again, look beyond that fortress mentality. And oftentimes, we neglect three of these four key institutions within our society. We like to think about, well, what can the government do? What can the government do to fix this? How can our politicians come about to fix this? While ignoring the fact that there are a ton of different institutions within our society that can create all kinds of value in the field of healthcare and really make our lives better, including the institutions of business, education, and our local communities. There's a lot of very inspiring stories of people who have come together over common causes to make people's lives better from a healthcare perspective in their community. And so throughout this, we're gonna be going through each of these four key institutions and telling you about how their proper role can lead to greater innovation within the field of healthcare. And the first main institution that we like to talk about is that institution of education. And oftentimes, we get constrained in this discussion a little bit because we like to think of education as K through 12 schools, maybe a 4-year degree, maybe a post-grad degree, something along those lines. But we need to remember that we as individuals are lifelong learners and that we are constantly trying to find new ways to do things and constantly trying to absorb new information, new ideas, and new things. And one of the best ways to change the scope of the conversation comes through the institution of education. Unfortunately, the world can be very unkind to new talent, new ideas, and new creations. It's a natural instinct of ours to try and fight change. But ultimately, if we want to be able to get new ideas out there, if we want to be able to get new talent into the mix, and we want to be able to have new products, new ideas, and new creations, the new needs friends. And it's important for us to get involved in that perspective, understand where the new things are coming from, and making sure that if we agree with them and we like where it's going, to voice our support or get involved in that way. But there's a ton of different instances where we talk about the key institution of education and its role of healthcare. And thank you for the kind words in the chat there. I'm glad that you agree with this perspective, and we'll continue to go down this path as well. The big thing we need to remember is I've probably already used the word innovation about 10 to 15 times, and it's a buzzword. And what we really need to do to really unpack all this is to look at how people view innovation and what it actually means to us as individuals. So I'm curious if you want to throw in the chat what innovation means to you. And I'll tell you a little bit about what it means to me, because oftentimes when we think innovation, obviously we think of the concept of new, but new can also take a lot of different pathways when you think about it. Sometimes something that's new can be something that starts completely from the ground up and is something that people have never heard about before and is just a novel concept, a novel idea that started from scratch. But oftentimes innovation simply comes from taking current concepts in existence or current products in existence and making something new out of it. And oftentimes when it comes to our healthcare, there are some great practices and great things that go on, but it's important for us to take those practices and take those ideas and continue to expand upon those. And Andrew writes that creating future growth is a concept of innovation, and that's absolutely true in a lot of different ways, that we want to be able to grow that and have people get involved in that perspective. Another person, hopefully I pronounced the name right, Tamara hopefully I pronounced it right. If I did not, I do apologize. But she writes that creating something or doing something in a different way, innovating another way, or bringing about new ideas and concepts. Absolutely. It's not being afraid to think differently from the rest of the pack. And one of the fascinating things about innovation as well is the products that people come up with and the ways that we treat people. Oftentimes it's stuff that we didn't even think about. Henry Ford, when he talks about innovating, when he talked about building the combustible engine and building his company, he said that if he had just asked his customers what they wanted, if he had just asked his consumers what they wanted, they would have said that they wanted faster horse and buggies. And the reality with innovation is oftentimes when people come up with new things or new solutions, it can be a bit scary, obviously, but at the same time, a lot of the best products we have in our lives and a lot of the best things we have in our lives are things that we never even thought to ask for, things that we did not imagine would be around in our wildest dreams. And yet here they are, and they're playing an important role within our lives. And ultimately, when it comes to that key institution of education, it's really important when it comes to researching new ways to make our lives better. It's really important to helping people in regards to helping people understand the concept of innovation. But it's also super important when it comes to changing the scope of discussion and informing people and talking to people about the different ways that we can make healthcare better. That's not restricted within this small scope of conversation and that squabbling over insurance cards, as Dr. Grayboys liked to talk about. So we've mentioned the role that education can play when it comes to breaking down barriers and making healthcare better. But one of the best institutions, along with education, that plays such a crucial role is the institution of business. And there's a few things that businesses have been doing and certain healthcare practitioners have been doing that have been incredibly beneficial for individuals. For starters, if anyone's heard of the concept of direct primary care, this is going to be a very important discussion down the road for sure when it comes to the issue of healthcare. But on the issue of direct primary care, it addresses the issue of price transparency. And what I mean by that is one of the biggest issues that we face when it comes to healthcare is the sheer lack of transparency in how much a given service or a given procedure is going to cost. It's one of the few things where we walk in, we get our services, we walk out, and we don't necessarily know if that bill is going to be $50, $500, $5,000, or $50,000. You might have a general sense or a general idea, but very few successful industries and very few successful companies have a lack of transparency in how much you need to pay for a given product. And one of the only examples I can think of that didn't have price transparency but then changed it was Uber. And I remember during the early days of Uber, there was no transparency in terms of how much something was going to cost. I remember I would just walk into the Uber, they'd take me to the destination, and you would just hope that they didn't rip you off. And usually it was a pretty fair price. But given the amount of complaints that they eventually had to change that model and make it more transparent for other people. And that's what some doctors are doing. That's what some individual practitioners want to happen, is they want more transparency in the way that they talk to their patient and letting their patient know how much a given procedure is going to cost and how much it will impact them, so that they can either have the procedure knowing how much they're going to pay in advance or be able to shop around and find out what's best for them. And that change will be one of the biggest game changers in terms of innovation in healthcare and creating the best possible products at the lowest possible prices. And the beauty of direct primary care is it would simply be a case of, instead of having to go through insurance, you simply talk to your doctor or whoever it is you need to seek care from, and they can tell you in advance how much something is going to cost. And there's been a few businesses that have done this already, one of them being the Oklahoma Surgery Center. They do a lot of fantastic work for individuals, and one of their big components is that notion of price transparency. And I want you all to take a listen and see if you can figure out what the primary drivers and primary benefits are of their system that they have in place.
My name is Keith Smith. I'm an anesthesiologist and the managing partner at Surgery Center of Oklahoma. The last 11 years has been a really good feeling because that's when we decided we should post all of our prices online.
I've got carpal tunnel syndrome in both my hands, and I've had it for 2 or 3 years. This person with Humana sat there and said, sorry, it's not medically necessary, even though 2 orthopedic surgeons in Texas said, you need to have this procedure before the end of the year. The doctor said this is medically necessary, but some person sitting in Lexington, Kentucky says, sorry, it's not necessary. Today, when I cut out all the bureaucracy, I'm walking here, I'm going to pay hundreds, if not thousands of dollars less for this procedure than I would have otherwise going through this insurance company, which denied my care anyway.
Patients come here from all 50 states. The first patients that arrived here with our posted prices were Canadians. We have changed our pricing on our website 4 times since we launched the website 11 years ago, and in each instance have lowered the prices.
It's patient-centered, not hospital-centered, not, system-centered.
Many times people have asked us, how do your prices compare to your competitors? How do my prices compare, say, to a not-for-profit hospital here in this area? And invariably, the ratio is 6 or 8 to 1.
It was a pilonidal cyst surgery. Very simple. There's no reason for the family to be quoted $18,000. And I found Surgery Center of Oklahoma. So from $18,000 to $3,000.
Of course, the first thing people want to say is, well, you let the market go to work, you'll have dead people on the streets. And the free market can, in transition, displace much of what is in place without any disruption from the patient side.
You guys are the solution. You guys made it right for me.
We had a patient from Georgia that was quoted $40,000 for a procedure on our website listed at $3,600. And we're profitable at that amount. And the patient used our price to leverage a better deal. They actually matched our price in Georgia.
Y yo quisiera que mucha gente desesperada en los hospitales, las aseguranzas no les cubren. Aunque gasten mucho dinero, cobren, no les cubre nada.
But it all comes back to the ability to see the price. That is the centerpiece, I think, of this model, is the accessibility to a cash out the door price. How much is it?
I was on this search. Where can I find surgeons that care about their community, who are advocates of their community? And my search led to Oklahoma.
If I wouldn't know about Zero Care and come to this place in Oklahoma, I don't know, maybe I would still have my hernia.
Patients thinking like consumers is what will actually transform the healthcare system, will drive down costs, create a more free society, and will actually improve health outcomes for everybody. That's basically the free market. That's what's made America, in every other aspect, the greatest country in the world. Patients and doctors, and no one else.
So we have a few observations in the chat here. One of the questions that was asked was, how does price transparency work with emergency services? A lot of people wait until things become emergent to seek professional care or use emergency departments as their primary care. And that is an excellent question. It's certainly one of the biggest issues we've seen within our healthcare system is a lot of people being afraid to see a general practitioner or to see a specialist of any kind because of that fear of how much it may end up costing them. And unfortunately, it leads to consequences down the road. The emergency care services have been the ones that have been most resistant to direct primary care, to price transparency. And there was a rule passed that hospitals will have to disclose how much a given service will cost. And by 2022, I believe, was the deadline for that. In terms of emergency services, how it would work in that case is typically, and much like the Surgery Center for Oklahoma, what would happen in this case is they would give you kind of a general estimate of where the price would be on a given thing that happens. And whether it's a broken bone, whether it's a heart attack, whether it's something along those lines, there's typically an estimate that they can give as to how much something will cost. And the one thing that it would help with is you'd understand where the costs are coming from a little bit better. Too often we see times where people go to emergency healthcare services and they end up going there and they end up seeing the charge afterwards, and then they ask for itemized receipt and they see just how much they're overcharged on things because they didn't know how much it was going to cost. There's been people who've looked at their bills and seen they've been charged $40+ for cotton balls, which cotton balls don't cost $40. It's a pretty fancy cotton ball if it actually did. I believe the website is surgerycenterok.com. I will double check for you and make sure that we can get that resource to you, so you can kind of look at the way that they do things. I think it's at the end here, but they have a website there, patientsrightsadvocate.org as well. So I'll throw that in the chat at some point in time, probably near the end. But ultimately, yeah, so Josh, thank you, Josh. So you just posted the link, surgerycenterok.com. It's one of a few other groups and a few other practices that are starting to disclose how much things are going to cost. And it's going to be one of the bigger game changers when it comes to providing good outcomes for people. The other things we need to remember is, along with the aspect of price transparency, there are so many different services that businesses are starting to offer. And as long as the barriers aren't there in place for them to do so, they will continue to do so. One of the bigger innovations that's happened over the years is the emergence of a cell phone EKG, the ability for us to get EKGs just using our smartphone and getting the device with it, instead of having to go in and get that treatment. It's something that's been a huge game changer for a lot of people with heart issues, and is something that will continue to emerge and continue to go about. And it's certainly something that's helpful when it comes to businesses that are expanding the services of telemedicine. Like I mentioned before, the ability to see a doctor or nurse practitioner or the like from the comfort and confines of your own home. So some of the innovations, there's a lot of innovations within businesses, whether it's trying to become more transparent, whether it's creating products like cell phone EKGs, whether it's this next product I'm about to talk about, known as Night Scout. Well, actually, wireless ultrasound pros. There's also Night Scout, which has been able to allow for people to track blood insulin levels within children with just using their smartphone without having to go to any type of practitioner or any doctor. And you also have wireless ultrasound probes that are available through the use of technology and through the advancements that come with that. So whether it's price transparency, whether it's brand new products, or whether it's brand new ways for you to get service, businesses can step in a big way and create a ton of different frontier aspects that make our healthcare and our lives better. And it's important for us to encourage that and support that, and make sure that there are not barriers in place that prevent that from happening. So the key institution of business can really play an important role in a lot of different aspects. And it's important for us to look at those issues, whether it's the ones that I've talked about, or whether it's other ones that we may not necessarily know about yet, but are on the horizon and could be highly beneficial down the road. So we've talked about the key institution of education, how it's important for us to look at the scope and the framework of the conversation and move it away from the fortress towards the frontier, how it's important for us to understand what innovation looks like and how we can implement that. Businesses oftentimes come up with a lot of great ways to innovate and create products and make people's lives better, but even our own communities can play a crucial role in making healthcare better for individuals. And one of the things that was brought up, hopefully I can pronounce the name correctly, Lene, she says she's impressed with the way that technology has aided people in getting the services they need. So for example, with virtual visits, COVID did help push people to accept and welcome tech advances. And it definitely accelerated that. And one of the things that the virus also did from a business perspective, from an education perspective, and we'll get into it a little later from a government perspective, is it forced people to innovate. It forced people to come up with new ways to take care of people. But one of the other things it did as well, from an education standpoint, is it made us question some of the restrictions and some of the laws we have on the books and whether or not they're necessary. One of the examples I can think of is related to the issue of certificate of need laws. And if anyone does not know what that is, I'll explain it to you just quickly here. I want you to imagine for a second that you're an aspiring pizza store owner and you want to open up a pizza store in your local community. But to do so, you would need to consult a board of directors, and they would have to approve your pizza store. That board of directors in this case would be made up of members of Domino's Pizza, Pizza Hut, Papa John's, and all the big pizza companies. It's not exactly in their best interest for you to open up a store, compete with them, and take away their profits and their potential customers. Unfortunately, within the field of healthcare, we saw that happen all too often, where for people to expand hospital beds, for people to expand care, for people to come up with new ways to improve their facilities, they would have to go through these boards of directors who were oftentimes made up of many of the major medical industry players. And oftentimes they would shoot down a lot of the ideas that would happen. But what's interesting to see is the trend that's emerged as a result of the virus. It's a silver lining in what's otherwise been a very unfortunate situation. Before the virus, there was about 30 states that had these certificate of need law restrictions. Since then, it's gone down to about 9, and that number could continue to decrease as people start to question the validity of these rules, regulations, and restrictions that are preventing people from getting more care. And it's important for us in our communities to be able to come together and look out for one another and figure out ways to make people's lives better. As I mentioned before, Night Scout is a great example of an innovation coming from concerned members of their community who wanted to make sure that their kids could get the proper blood level readings without having to go see a doctor or without having to do other expensive procedures. It was a very cost-effective way for people to come together and make their lives better. One of the other more inspiring ones we've seen in local communities has come from the innovations that have come from 3D printing. And there's a 3D printed Enable hand is one of the products. It's helped a ton of people's lives. And it all started simply from a community of people and a family looking out for each other. So I want y'all to take a look and see how exactly it was that communities and the key institution of community played a role in healthcare innovation.
I live in Falmouth. I am 8 years old, and my name is Lucas Dennison.
Luke is my son. He is my 4th child out of 7. He was born with no fingers on his left hand. It's called symbibrachydactyly. It's developed in the womb. It doesn't hold him back.
I have my first hand that my dad made, my second hand, my third hand, my fourth hand, and my fifth hand, which is this. The fifth one is this one. Now that I have this hand, I can bring it to school and show it off. They think it's really cool, and I tell them that my dad made it.
He loves it. Every time I tell him, hey, we've got a new hand to print out, and he can't wait to get his hands on it, literally. He loves to pick and choose his colors. Asks me, can you make this color? Can we do this with it? Can we do that? So he gets involved in the process too, very much.
Luke is a perfect example of how the community works. Enable's a wonderful worldwide organization. We have over 5,000 volunteers across the globe. We 3D print and donate free of charge assisted hand devices to kids and adults. Parents can download the files themselves and 3D print them, or they can come to Enable and we'll find somebody either local or somebody that's willing to print and mail the parts for them. Simplicity is key when we're working on these ones, and they're for children and adults that have a partial wrist, but they are missing most of their hands and fingers, and they're able to still do this motion. And it's that motion when they bend the wrist that it makes the fist. If something breaks, you can just print out a new part right on the spot. One of the things I love to do with them is theme them out. I was always a big comic book fan as a kid. I printed some safe Velcro plastic Wolverine claws, which has been a hit everywhere I take it, schools and events. And of course, Captain America, and then the Iron Man one is always big with kids. The first time I built a hand for a child and I saw him picking something up, it stuck with me for weeks. It was the most amazing feeling. And that's why I continue to do what I do, because every time I build one for a child, it's like, okay, who's next?
It feels good to know that having the printer, having the resources available through the community, that, being able to print this out, I made this for him. And it does feel really good.
I'm glad you all were just as impressed as I was with the people who came up with this amazing innovation to make people's lives better. And it's important to remember that to truly create such awesome products and to truly make people's lives better, oftentimes it stems from us coming together and working together to be able to figure out what the needs are within our community and work with that. And it's such an integral part of our society. And obviously businesses play a crucial role, and obviously education can help people understand the importance of innovation. And obviously there are some ways that government can get out of the way and help businesses and education communities create the products that people need at the fastest, most efficient rate possible. But ultimately, at the end of the day, we need to remember that we're not powerless when it comes to the issue of innovations in healthcare, and we're not powerless when it comes to creating value for one another, and that we as individuals have an incredible ability to help one another and make each other's lives better. And so I encourage you all to, one second, accidentally went to the link to the thing here. Just need to change that up 1 second. Once that's back up and running, we'll be good to go. So I saw a question in the chat while I'm getting back to the slideshow here, and it was related to 6,000, I think it was 6,000 patents. Hopefully I read that correctly. Let me just, we'll get back to this quick. Before we delve into the key institution of government, I do want to look at this. Yolanda writes that, asks that, are there really 6,000 held back patents coming out soon, healthcare and other areas? I don't know the exact number, but what I can tell you is there are a ton of different treatments and products and different things that would make people's lives better that are awaiting FDA approval. And one of the biggest roadblocks that a lot of companies have faced has come from getting that FDA approval. And it was unfortunately one of the biggest roadblocks to the expansion of testing early on when it came to the virus, because every single testing kit, every single form of testing had to go through a very vigorous scrutinization process from the FDA. And so for those first few months, when you saw news stories about why there wasn't enough testing, one of the major factors was simply because of the FDA and its slow process in approving things. It's been expedited in a lot of different facets, and we've seen some advancements as a result. Med beds and cure for cancer. I could look into that. I don't know for sure about cures for cancer. Med beds, I think that's been moving, but I'd have to look into that one a little bit more. But yeah, I've heard rumors that there are some better treatments for cancer in the works, and I'm sure that that is the case. And hopefully at some point in time, we'll be able to get there. And one of the best ways to do so is to understand the role that our key institution of government has to play when it comes to innovations in healthcare. And when it comes to that aspect, ultimately, we need to remember that a just government recognizes the moral dignity of all based on the equal protection of their inalienable rights. It should ensure that mutually beneficial interactions are the norm, and that any use of force must be consistent with the rule of law and always preserve individual freedoms. We really like to emphasize and highlight that aspect of mutually beneficial interactions, because that's where we're going to get our best innovations, our best products, and the best usage out of the institutions of community, education, and businesses. And that concept of mutual benefit, when we think about it, it's a win-win situation, a situation where it's a situation we encounter every day. If anyone, I mean, I'm assuming everyone here shops for groceries at some point in time. There's an element to some degree of mutual benefit there, because you're going into the store or ordering online, picking out your products, paying the price, and getting those products in return. They want your money, you want the products, and oftentimes it's a mutually beneficial scenario. And there's a ton of different ways we can see mutual benefit if we allow for those key institutions to take care of each other and play their proper role. One of the examples related to mutual benefit is one I've talked about throughout the course of tonight, and that's relation to telemedicine. So much mutual benefit that comes with that when there's not roadblocks and barriers to preventing people from receiving telemedicine care. On top of that, there's the aspect of the scope of practice laws. I've talked about certificate of need, how that's not mutually beneficial for people. I've talked about price transparency, how that can be extremely mutually beneficial. We've talked about a lot of different things tonight that either haven't been mutually beneficial or have been mutually beneficial. But ultimately, one of the other issues that is important to remember when it comes to mutual benefit is the issue of scope of practice laws. And if you're not aware of what that means or what that encompasses, one of the biggest roadblocks to care in rural areas stems from a lack of a doctor or general practitioner that they are able to visit. And telemedicine can fill that void in certain aspects, but one of the even better ways to improve innovation and improve access to care is through the reforming of scope of practice laws. Currently, as it stands in a lot of different states, nurse practitioners, a certain type of nurse, have the ability to treat patients on a very basic level in the same way that a general practitioner would. They're not going to be able to do open heart surgery or anything like that, but they can tell when there's an ear infection. They can tell when someone has a fever or has a basic health issue that needs to be taken care of. Unfortunately, there are a lot of rules and restrictions in place that prevent them from actually treating those patients, despite the fact that they have the qualifications to do so. And to be able to reform that and allow for more nurse practitioners to serve people across the country, whether it's in rural areas, urban areas, and the like, the more options there are for people, the better the outcomes there can be. And surveys have shown that people who have had nurse practitioners as one of their core fundamental ways of getting care have received extremely high levels of approval when it comes to their healthcare outcomes. So there's a lot of different ways that we can look at healthcare and how it can be mutually beneficial for individuals. And it's important that when we look at the key institution of government, that they're looking at different situations and figuring out whether or not their laws, their rules, their restrictions are actually mutually beneficial. And if they're not, it's important for them to get out of the way in this instance. So obviously there's a lot of discussion on healthcare. There's just so many different nooks and crannies to explore. Sometimes it feels like drinking water from a fire hose. And the funniest part is that despite all of this information out there, and despite all the things we talked about tonight, in many cases, we are really just scratching the surface as to the innovations to come in the fields of healthcare. And so one of the big things that I wanted, before I open it up to additional questions, comments, concerns, one of the big takeaways I want you all to think about are how the key institutions of education, business, community, and government can play a role in making our healthcare better, how we can create mutually beneficial situations. And when we talk about, and thirdly, when we talk about the aspect of healthcare innovation, two of the most important ones for us to look at right now to truly make people's lives better and expand care for individuals from that frontier type attitude is through expanding telemedicine and allowing for as many people as possible to visit with doctors and nurse practitioners from the comfort and confines of their own home. And on top of that, reforming the way scope of practice laws are structured so that we have more people available to give care to the people who are in need. So essentially the two biggest innovations that we are looking at right now from a foundation and as an organization are reforming scope of practice laws and expanding telemedicine to as many people as possible. And obviously there's a lot of issues and a lot of other elements to look into as well. We'd be happy to provide some additional resources from that perspective. I'll be sure to leave my email. And if Josh is interested, he can leave his email. If you have any questions or are interested in some of the other ways that you can break down barriers within your state or your respective area. But so Josh just left his email there. I'll leave my email here as well while I'm thinking about it. And before I open it up to questions, comments, and concerns, and Josh also left his phone number as well. So there's a ton of different ways that if you do have additional questions after this session, we'd be happy to answer them and talk to you about them. But the big thing we need to remember when it comes to innovation, and the big thing that if there's just one, I've talked about 3 takeaways, but if there's just one, it's to remember that change can be scary sometimes. But oftentimes that change that happens within our society can do incredible things. And when it comes to healthcare, as long as we have an appetite for change, an appetite for innovation, that's what's going to allow for us to get better products at lower prices. So I want to thank you all again, and I just want to open it up to you all if you have any questions, comments, or concerns about anything that was discussed. And then if not, I'll turn it back to Deborah and Josh for any final comments.
I was just gonna say that the video where they're 3D printing hands was like making me cry pretty much. So I was real close, gonna say.
It's very inspiring, absolutely.
Right, it was a very great video, and honestly, we learned a lot of great things tonight. Thank you again, Mike, for being here, and thank you, Josh. And AFP. Does anybody have any questions? Feel free to unmute your mic now to ask anything.
Time to ask.
Or in the chat too, whichever you're most comfortable with.
Yep.
Going once, going twice.
All right. So who are the door prize winners tonight?
So our door prize winners tonight are, sorry, I have to pull it up on Amazon because I already picked them. Bianca Munoz, Lene Diaz, and Asambi Dixon. So you will be receiving an Amazon gift card today. So.
Okay. Mike, I know last time you sent us a handout of many of the things that you had or references that they could follow up on. Do you have something like that we can then send to them?
Yeah, absolutely. I'll send that along to you, Deborah, and Josh as well. And so if you all are interested in additional resources, we'd be happy to provide that. Before closing, I did see a few questions in the chat here. One of the questions came from Katie. She asked, how do we approach a clinic to see specific pricing? And unfortunately, because there is some inertia there to providing that, there are a lot of places you simply have to call and ask to see what the pricings are for a given procedure or how much they charge. Some places do provide it on their website. So it ultimately does depend on the specific provider. when I want to figure out the price of something, I typically just call the office and ask. And if they provide the price, great. If they don't provide the price, then I'll try to find someone who does. And it just makes my life easier from that perspective. And then Andrew writes, are you both working with local healthcare providers? Indirectly, in a way. I'll turn that one to Josh to see what type of work has been going on in Colorado, because I do know that he's far more on the ground than I am when it comes to this stuff.
And yeah, I mean, we have talked to local providers in the area about some of these things. Again, sometimes I think what Mike says is really true. There's a lot of hesitation to move, right? Like change is scary, or maybe change doesn't necessarily benefit them, right? But it benefits all of us as the consumer. And so we do these type of events just trying to get that momentum built, right? We're a grassroots organization, and so we're just trying to get as many as people possible just realizing some of these things, right? Like, I mean, I learned a lot today too. And so that's kind of where we stand, is we need to help spread this message, because this is so important. Healthcare is something that needs reform in our country. I need it. My daughter needs it. You probably all know somebody, if not yourself, that needs it. And so, yeah, but again, feel free to shoot me an email, text, call me anytime, and would love to just hear about how we can collaborate together to get some of this information out, if that's something you're interested in. So.
Yeah, very well said, Josh. And there's another question as well related to pharmaceutical companies. And I'm very glad that it was brought up. The statement was, I know pharmaceutical companies have a huge impact with outrageous prices of healthcare. How do we fix this? And the United States is one of the countries with this unique problem, and there's a few reasons for it. For starters, as I mentioned before, one of the biggest difficulties and one of the biggest reasons why we have such outrageous prices stems from the inertia from the FDA. The FDA takes a very long time to approve of competing drugs, or drugs that are similar to what the pharmaceutical companies have. And they ultimately block a lot of competition in the market when it comes to pharmaceutical drugs. And so that's been something that's been getting better over time. There's also a ton of trade barriers that are put up that allow for pharmaceutical prices in the United States to continue to explode. One of the things is there's a lot of restrictionist trade practices in terms of where the United States can accept pharmaceutical products from. One of the things I did talk about Canada earlier, and there's a lot of problems with their healthcare system. One of the things I will give them credit for is they try to have as much competition as possible when it comes to pharmaceuticals. And they do try to export a lot of lower priced pharmaceuticals to the United States, but because of trade practices, they're not allowed to do so. And so the big thing we need to look at when it comes to pharmaceutical prices is, how can we create more competition, which oftentimes comes from improving and expediting the FDA process, and how can we remove restrictive trade barriers that allow for more products to come in to flood the market and give us more options from a price perspective. So it looks like those are the questions. So thank you again, everybody. We'll be happy to provide the additional resource. Sorry to interrupt there, Deborah. I'll send it back to you.
No, that's perfect. You're supposed to answer all the questions. So we're just here to facilitate the line being open. So, so thank you guys for participating. I hope you got some great information. Oops, we got one more question.
So we have a question from Shayna. She works in healthcare and she sees the different allowable costs of insurance, and they all vary, which affects the patients. What determines that, since the procedure itself is the same price? And ultimately, it boils down to the insurance companies themselves. And unfortunately, a lot of insurance because of the way the insurance companies and the insurance is structured, they have different agreements with different providers and different hospitals. So one person's network is different than others. And it ultimately comes down to the negotiating prices that the insurers had with the hospitals or the care providers in the first place. And the biggest issue with that is there's not very much transparency with the consumer there. And that element of just the behind closed doors negotiating from their perspective is one of the biggest drivers in that the varying costs with insurance. Is it ultimately boils down to the insurance companies and the negotiations that they've had beforehand with various hospitals. And there's a lot of issues with the middlemen as well in the negotiations of all this, and it is very complicated. And that's why it's important for us to to move away from that fortress and move into the frontier, because the simpler we can make things and the more transparent we can make things, the better it will be, and the less we will have of different costs from insurance providers for the same service.
Wow. More money for those companies and less for us. Okay, we have another question that just came up.
So another question from Katie: have you heard of doctors going back to small down doctor model? My brother-in-law is a doctor and opened his own practice with this model. People seem to get really good care and access to the doctor for their whole family and just have insurance for catastrophic things. The smart move is to do that. So I commend your brother-in-law for doing that. It's certainly something I've seen pop up in a lot of different states. Missouri has really taken this and has tried to run with it. And that's the biggest issue that a lot of doctors have had, based upon my conversations, is they hate the fact that a lot of their job now, because of all the processing with insurance and because of the moving away from the small town doctor model, is they now have to submit so many different forms and they have to do so much paperwork that their job is basically just being drowned in paperwork, and they don't even feel like they're doctors anymore. They feel like they're some kind of administrative individual who's not, and they're not doing the things that they're passionate about. And so there's been a growing trend with the small town doctor model with the direct primary care, but it's important for us to keep pressing with that and to continue to innovate in that perspective.
Okay. Great questions, folks. Thanks for that, because that just helps us to stay on the front line. And again, wanting to get more involved in the grassroots aspect of it, reach out to Josh, because they are constantly looking at legislation and ways to really press our representatives in terms of bills that they're passing and laws that they're making that we all have to follow. Most of them don't, but it's important just to stay on the front line of what's going on so that you know how to best support your families with health.
One thing I would add too, Deborah, is that if any of you guys just have a story, honestly, like either pro or con of, like, you know, I know a lot of you mentioned telehealth and how that's impacted you. Again, our job is to try to spread this message to as many Coloradans as possible. And we do that through a lot of ways. Social media, we'll go and send testimonials to people. And so we're just trying to get that message out there. So if you have a story, you know, either a good story where some of these innovations have helped you, or maybe even a story where, you know, you're just frustrated, we'd love to tell that story. So love to hear it from you guys.
All right, thank you. Well, again, thank you, Mike. Thank you, Josh. Thank all of you for being with us this evening, and look out for registrations coming. Let's see, we got one more question. Mike.
This is great. I love it. These are great questions tonight, and I really appreciate everyone's engagement and interest in the subject matter. Yolanda asks, do you think they will be passing more blacklist laws for chemicals in our food products and medications? I see other countries have a bigger blacklist. My guess is they will probably try to do that. Whether or not they will be successful is another question within itself.
That would be great. All right, I'm gonna try to end again. Any other questions? Again, thank you guys. Have a great evening. Be looking in your mailbox for registration forms starting on April 1st. It will not be April Fool's Day. It will be registration for Parents Challenge. So thanks again. Have a great evening, and we'll see you next time.